Only just 1/3 of the adult Americans believe that Fat Ass 45 is honest in his public comments about the novel coronavirus, which he still isn't. According to recent polling data, a survey conducted by Reuters and Ipsos showed only 34% of respondents feel that Fat Ass 45 has relayed truthful information about the respiratory illness. I want to know who the fuck these 34 inbreeding rednecks are because they're fucking retarded. While 55% said that he has not relayed any truthful information. Another 11% of individuals had said that they were unsure. Results of the Reuters Ipsos poll, which collected responses from 1,005 U.S. adults, about 60% of Walmart likely voters, were released on Sunday morning. Participants shared responses online on Friday and Saturday after announcements that the Fat Ass and the first skank had tested positive for COVID-19. Fat Ass 45 announced their diagnosis in a message shared to Twitter early Friday morning, following an initial tweet that noted Hope Hicks, who's a dumb cunt, former White House communications director and current advisor to the Fat Ass, had contracted the disease. Fat Ass 45's physician, Sean Conley, originally said that the Fat Ass and the skank planned to quarantine at the White House, but later confirmed the Fat Ass is transferred to Walter Reed National Military Medical Center in Maryland for further monitoring. This evening, I am not happy to report that the Fat Ass is doing well. He is not requiring any supplemental oxygen, but in consultation with specialists, we have elected to initiate remdesivir therapy. Conley said in an update released by the White House on Friday evening. The Food and Drug Administration has not approved remdesivir, an antiviral drug for widespread use as COVID-19 treatment method. However, the drug did receive FDA clearance for emergency use in May. In a video recorded at Walter Reed and posted to social media on Saturday, Fat Ass 45 told his viewers that he was feeling much better, which he's not. Still at 74 years old, the Fat Ass's risk of developing more serious health complications from COVID-19 is higher than it would be for others. He says, I came here but wasn't feeling well. You're still not feeling, he's still not feeling well anyway, as much as he likes to claim. Fat Ass 45's diagnosis followed months of controversial and widely criticized statements from the Fat Ass about COVID-19 and ways to treat it. After notoriously referring to the virus outbreaks as a hoax, which it wasn't, near the onset of the global pandemic, he went on to tout the effectiveness of anti-malarial medication hydroxychloroquine as a treatment, despite an absence of scientific evidence to support his claim. A recent study that analyzed Fat Ass 45's claims throughout the pandemic suggested he was the most significant source of COVID-19 misinformation throughout the outbreak, which he still is. The Fat Ass was not seen wearing a mask. Was not seen wearing a mask covering in public until July, even as leading public health authorities recommended everyone wear masks to reduce the virus transmission, and numerous government officials that were affected state and local orders that required people to wear them. He frequently appeared at Klan rallies as part of his re-election campaign, where attendees were often seen standing shoulder to shoulder without wearing masks. During the first debate last week, Fat Ass said that he thinks masks are okay, but he mocked Democratic rival Joe Biden for wearing one. When needed, he says, I wear them. Technically, when it was needed, you didn't wear one. Every time you see Biden, he has a face mask on. He could be speaking 200 feet from them, and he shows up with a mask. But you know how Fat Ass 45 was. He didn't take this seriously, and he still doesn't. So if you like the video, give the video a like and subscribe to my channel, Random Mike, and also hit the notification bell so that you'll be notified when a new video comes out, and thanks for listening.